Welcome to the American Experiment podcast. I'm John Hinderaker today with Peter Nelson. Peter, you have been with American Experiment for a long time. How long? If you,
I'm not sure if I want to admit to how long here.
Well, let me rephrase the question. In what year did you begin?
Okay, if people can do the subtraction probably, or the addition as the case may be, but I've been around here since 1997.
And you're actually a lawyer by profession, but have done policy work in a number of areas. But the one that you've really gotten known for is healthcare. And after the 2020 election, when the Trump administration came in, they hired you away from us to do work on healthcare in the Trump administration. Talk about that a little bit.
Yeah, so prior to working at CMS in the Trump administration,
Wait, CMS, what's that?
I was here at American Experiment, and really had spent pretty much my entire career here, with just a little break to go to law school. And when the Affordable Care Act passed, I found myself in Minnesota as a conservative in a state that was basically pushing forward every sort of ACA policy that a lot of other states were trying to reject, and other conservatives were demanding be repealed. And I absolutely agreed that, look, these are bad policies, but I lived in the state of Minnesota where Medicaid expansion was happening, where a state exchange was being built, and also, and so I had to deal with all of that. And so I was always looking for ways to make the ACA sort of work in a better way in that environment. And with the idea that, look, this is the law of the land, and it might actually stay the law of land. It's, of course, being litigated in the courts for years. And at the end of the day, by 2017, the courts had basically upheld the law. It was still the law. And I'd been working on several policies in the state of Minnesota, how to make a state exchange that actually was market-based and wasn't full of government mandates and regulations. I've been working on those policies. I've been working on waivers that would allow a state to basically exempt itself from different ACA requirements. And I've been working on all of this stuff. And I was one of the few people in the country that had really dug deep on these issues. And someone in the Trump administration saw that and said, hey, maybe you should take a look at working here. And so
you went to Washington, D.C. Mr. Nelson goes to Washington.
Yes.
And you said that you worked at CMS. What does that stand for?
The Centers for Medicare and Medicaid Services.
So what did you do there?
So I did not work on Medicare, and I did not work on Medicaid. That agency also works on insurance regulation. And so I really focused most of my time on insurance regulations and state-based exchanges and the federal exchange where people go to buy subsidized insurance coverage.
I think one of the things that you worked on was price transparency regulations. Is that right?
Yes, indeed. I worked on regulations that were related to requiring health plans to report their negotiated rates. So as I said, I was working on mostly the insurance side of things, and our regulation was basically subjecting health plans to price transparency.
So the Trump administration did a lot of good things in the field of healthcare, for which I don't think it ever got any credit, typically enough, and or at least not enough credit. And so after the 2020 election, you were out the door, I assume, to be replaced by a Biden staffer of some kind, and happily chose to come back to Minnesota and to American Experiment.
Yeah, that's right. When I left the administration, I was looking for a place where I could have the independence to work on all the policies that I thought were important, that I was passionate about during the Trump administration from the federal level. And that really sort of blended well with coming back to American Experiment, because a lot of those policies also have a huge impact at the state level. And we're a state-based think tank, and when things happen at the federal level, it impacts the state. And so it really is important, at least, especially in the healthcare field, to be able to work in a place like American Experiment, where you basically have to work on that interaction between state and federal policy. And so
we see that in a growing number of areas, I think, where there's that interplay between federal and state, and you really can't look at either one of them in isolation. So just kind of moving the story forward, though, the 2023 session of the Minnesota legislature, possibly the most disastrous on record. They took a $17 or $18 billion surplus and rapidly turned it into both a tax increase and now a deficit. That was an amazing negative accomplishment. But one good thing, and I would say maybe darn near the only good thing they did was they did pass healthcare transparency legislation that was, I think it's fair to say, largely your brainchild.
Well, yeah, it was definitely something I helped drive in the prior session. I worked with Republicans and Democrats in the legislature in the 2022 session to develop legislation that basically put in state law the regulations that I was working on at CMS, and basically codified at the state level some of these federal requirements and also expanded on them. And so instead of just certain requirements applying to hospitals, they also applied it to other care settings like ambulatory surgery centers.
Which is where a lot of these procedures are done nowadays.
Oh, yeah, absolutely.
That's a hugely important expansion.
Yeah, and a lot of this has to do with the fact that during the Trump administration, we had a statute that we could work with. And we had to work within that constraint. And so we couldn't go beyond what the statute authorized. And so when it came to regulations that we had in hospitals, it was limited to hospitals. We couldn't go to a urology clinic. You can do that when you're a lawmaker in this state.
So that legislation passed, and it was the one real achievement, I think, of the 2023 session. We've mentioned price transparency. We're going to talk a lot more about it, but let's just pause for a minute now. What does that mean?
Well, so historically, as a patient, you've never had access to pricing before you get care. Health plans and hospitals have always kind of considered this proprietary information that's trade secret, and so historically, everyone sort of has to wait to get their explanation of benefits in the mail after they get care to know exactly what something is going to cost.
That's very weird. Can you imagine buying a car and taking it home and then you get the bill? You know, they didn't tell you the price.
Yeah,
it's very strange.
It's strange and actually kind of shocking that it's taken this long to start addressing that issue because it is so strange.
So when we talk about price transparency, whether it's legislation or regulation, you know, what's the goal? What does that really mean?
Well, the goal really is to bring the traditional market forces that rely on competition in every other industry to bring down prices, to bring up the affordability, to improve affordability and improve quality. We see that in every other industry. We see how competition, when consumers are able to pick and choose based on price and quality, how that drives improvements in pricing, drives improvements in quality. We don't see that in the healthcare space because no one knows the price.
So I mentioned cars. That's a great example. You know, there's probably 15 or so automobile manufacturers around the world. They all compete globally. They compete strenuously. Yep. And cars keep getting better and better. They last longer and longer, and the prices aren't going up, at least not much. And in some cases, prices coming down. And that's because you go shopping for a car. You know, you can see its features. You can look at the car. You can test drive the car. You see what the price is, and you can make a decision. And that's a competitive market that keeps giving us better and better products at competitive prices. And healthcare is one of the very few markets. I think education is probably the other huge one,
which also happens to be funded by the government.
Exactly, right. And where the whole pricing system is weird at best. And those are the areas where costs have just risen, you know, outrageously, whereas costs of most manufactured goods have been really under control.
Yeah, and that's exactly right. And a lot of people say, well, wait a second. When people do know the price, they don't use the price. And that's a statement that is sort of true, but you've never been able to develop consumer tools, patient tools, because you've never had the price in the first place. And my hope is that the next step, when we actually have the price information, and this was really the idea behind price transparency within the Trump administration was to basically get the prices out there so third parties could develop shopping tools for people. So they would actually use the price. Because historically right now, yeah, we've seen some employers come forward with some efforts to give their employees some pricing information, and it hasn't really been used as much. But you know what? Those are small efforts, and with pricing information finally out there, we're going to finally actually know what's going on.
Well, there's a whole revolution that needs to take place here because we're all used to this weird system where you don't really shop for healthcare for the most part. And so there's a whole mental kind of reorientation that needs to take place. Tell me this, though, Peter. How do insurance companies fit into this story?
Well, insurance companies, we all rely on insurance companies. Let's just start from that point. None of us can afford triple bypass surgery out of our own pocket. So we need
at least
insurance.
Not all at once. We pay for it over a lifetime in our insurance premiums.
Yes, none of us have saved up enough money to pay for something like that when we need it. And so we all depend on insurance to pay for our health care. And they become this third party that pays. And that's actually one of the reasons why healthcare costs so much, is because there's a third party. The person that's actually pays directly for it.
Yeah, the consumer, the one who's making the decision, is not the one who's writing the check.
Exactly.
And that never ends well. So how does the whole price transparency effort fit with the insurance companies?
Well, part of what we kind of hope to see happen is that you're going to see insurance companies develop better products that actually make patients care about the price. And we've seen this start in various places. So, for instance, CalPERS, which is the state of California's health plan, it actually has this reference pricing approach to healthcare. And basically it says, hey, look, we'll pay up to this price for your triple bypass surgery. But if you want to pay more than that price, then you've got to foot that bill yourself. And so it's a start to basically saying, hey, look, here's where we'll go. And now there's actually approaches where if you actually choose a price that's lower than that reference price, you get to share in the savings. And that's, by the way, something we started to try to move forward more in a traditional insurance settings under the Trump rule that I helped work on.
Aha, so that makes sense. So if you as a consumer shop around and find a better price from a provider that you're willing to use, you actually can put some money in your pocket.
Absolutely. The state of New Hampshire actually does this right now. Their state program lets you share in savings. The state of Kentucky does this. And there are some other types of employer groups that are able to do this right now, too.
Okay, so that all makes a lot of sense. So what I really want to ask you about today, Peter, is the legislation that passed earlier this week in the United States House of Representatives. Again, another major step toward price transparency, restoring competition in healthcare, getting both prices under control and quality in a way that consumers can actually select. And again, you were in the middle of it. Tell us about that.
Well, yeah, I played a role in this legislation because what this legislation does, it largely puts in place in federal statutes two of the rules that came out of the Trump administration, the hospital price transparency rule and the health plan price transparency rule that I played a lead role in. And so because it basically was adopting those two things, I was naturally tapped for some advice on what that legislation would look like. And I'm pleased to report that the House did pass this bill on Monday, and this bill basically moved forward with the rules that we put in place that puts it in code to make sure that it is there for decades to come.
And it passed overwhelmingly, too.
It did. It passed, I believe it was, I might get this number wrong, but I think it was 320 to 71.
Yeah.
And it needed the 2/3 majority because it had to bypass some rules. And so it got that 2/3 majority.
So that was a solid bipartisan legislation passed there by the House. And by the way, one thing that's kind of nice to see is the good work that you did on price transparency in the Trump administration. There are some areas where as soon as the Biden people came in, they set about undoing good work that had been done by Trump's people. That didn't happen here, though, right?
No, and in fact, the Biden administration, to their credit, picked up on this pretty quickly. And the price transparency rules that we worked on were part of one of Biden's executive orders within the first 6 months he was in office. And he basically instructed the Secretary of the Department of Health and Human Services to keep doing the work that we had started.
So the work that you personally, Peter, have been doing in the field of healthcare is actually a great example of the fact that there are some things, sometimes you just almost despair of anything getting done, certainly getting done on any kind of bipartisan basis. But this illustrates that there are, in fact, some things where we can move forward, make tangible progress, and do it with support from both parties.
Yeah, that's exactly right. And, there are some times when we all actually care about patients. We care about consumers, and there are definitely times when the left and the right can come together to do the right thing for patients.
So that bill that you were heavily involved in there, based in large part on your work in the Trump administration, passed overwhelmingly in the House. Now it goes on to the Senate. The Senate is a funny body, as we all know. So what are the prospects of this bill in the Senate?
Well, when you look at the bipartisan passage in the House, I have a lot of hope that it's going to make it through the Senate. And I would hope that it's not going to be changed all that much, because I think it really got to a great place in the House. It really reflects the rules that are currently in place. And also importantly, it does take some efforts to expand. And that's where to places where we really couldn't go on the Trump administration. Like I mentioned before, how the state of Minnesota legislation that I worked on went beyond the hospitals. This legislation also goes beyond hospitals to diagnostic imaging.
Critically important, yeah. Because a lot of the procedures that frankly are fairly generic, there's multiple providers, and goodness knows what their rates are, but this is really a fertile soil where there ought to be price competition. It ought to really help.
Yeah, absolutely. And once it's in law, and this is the thing that we were concerned about, when we passed the law, one of the things that kept me up at night when I was writing the legislation, and literally up all night when I was writing the legislation, was making sure that we had the legal justification to stand up in court. And we did get challenged in court from the pharmacy benefit managers, and they stalled some things. And so we don't have prescription drug price transparency from the health plan rule yet. The Biden administration has committed to moving forward with that, but that's been stalled. And you never know what's going to happen in the future. Who's going to want to pare something back? Special interests do get involved in these things, and they do water things down. And once this is in statute, which hopefully it will be in short order, then all of a sudden it's locked into statute, and it's going to be much harder to get watered down.
So do we have a timeline on this? When do we think the Senate's likely to be acting on that bill?
I am not, I do not know the Senate schedule. And, this is my first really real experience working with people in Congress. And so hopefully, early next year, we'll see this taken up.
Well, I think this is a great example, Peter, of the top-notch expertise at Center of the American Experiment. You're obviously a nationally known expert in the field of healthcare. And it's also a great example of how our work is extremely impactful here in Minnesota, but also impactful in a number of other states, as well as at the national level. So kudos to you.
Well, thank you so much.